So, ladies and gentlemen, welcome to this press briefing. I think, as you can see behind me, it's a convening of stakeholders working on gender mainstreaming. We have government departments, ministries, and agencies here represented. We have non-state actors also, particularly the Nakuru County SGBV working group. And today at this conference, we are actually convening just to discuss pertinent concerns with regard to the impact of COVID-19 pandemic, particularly for vulnerable and marginalized groups. Most of you have witnessed these things happening, and we wanted to sit and see how well we can deliberate on the next urgent action steps to address this concern. So I'm going to go through part of what is emerging, and then my colleagues here, I think we have Prof from the Egerton University, and Cosmas also from Hope in Life, and then lastly Harriet from Wakili Mashinani will read the last part of the action points. So some of the emerging issues that we have seen, and I think it's something that you would agree, is the issues of gender sensitivity in terms of response. And it really came out strongly that during COVID, stakeholders were not really very prepared in terms of seeking to address this concern using and taking, of course, cognizance of gender concerns. Another thing, of course, is coming that is coming up is the increase in the number of sexual and gender-based violence. Yeah? So we had a pandemic, but there was another shadow pandemic that actually cropped up, and they need to address these things. Increase in domestic violence was really high, and thus we needed to have, of course, we spoke at length about that. The other thing, of course, is the issues of medical and social perspective, and of concern that is actually coming out strongly is how mental health concerns were really pertinent amongst the Kenyan population, and particularly here in Nakuru, where we saw emotional and psychological well-being of many people, particularly those who underwent a lot of victimization and challenges, were not really taken care of. Very lastly, I think representation of women, youth, and persons with disability also is something that we have reflected on moving forward. And of course, this is coming at a time when during COVID, participation of VMGs, those are the vulnerable and marginalized groups, was really low. So ladies and gentlemen, at this juncture, let me invite Prof just to share some of the actions that we have deliberated as the next urgent steps. Karibu.
Thank you. In response to sexual and gender-based violence, we've agreed that we shall sustain public sensitization on prevention mechanisms for redress of sexual and gender-based violence. And the county government of Nakuru shall design recovery and economic empowerment programs for the survivors. And the county department of gender will be taking the lead. And they shall also sustain medical and social legal services for the survivors of sexual and gender-based violence. When it comes to the recovery center, Nakuru Recovery Center, the country government shall fast-track the construction of this recovery center so that we can be able to roll out the services for delivery. And the action leader is the Gender Directorate. We shall also be able to coordinate response to sexual gender-based violence in Nakuru County through information sharing, referrals, and follow-ups, and this shall include effective and efficient management of issues affecting children as well as teen murders. And here we will look at the National Gender and Equality Commission that is stationed in Nakuru, Gender Sector Working Group, and the sub-county GBV clusters. They'll be on the lead. We shall also raise awareness and enforce mechanisms for responsible use of internet to protect children from cyber bullying, online sexual child exploitation, kidnapping, and other related social vices. And here the Department of Children Services will be taking the lead. We shall also continue to provide legal aid and support services for marginalized and vulnerable groups. And the action leader is Nakuru Legal Aid Providers Working Group.
Yes. Yeah, thank you. That was part A. My colleague Cosmas can proceed with the actions.
On support to mental health, we shall provide training on mental health sensitivity to all stakeholders in the sector And again, we shall provide psychosocial support to marginalized and vulnerable groups on need basis. And number 3, on the same, we shall undertake mobile clinics across the county on mental health in 2 weeks' time. All stakeholders expected to spread the information. On support to teenage parents, the Department of Children's Services shall map and develop database of teenage parents across the county. Again, we shall develop programs to support continuity of education for teenage parents. And again, on the same, we shall engage parents, so guardians, to support teenage parents. Action group is the Department of Children's Services. On planning and budget process, we shall deliberate and on friendly mechanism to mobilize and sensitize the youth, women, persons with disability to participate in county planning and budgeting process to ensure their needs are prioritized. The lead department will be Nakuru County Civil Society Forum. Again, that the academia shall continue with research, generating knowledge to inform various interventions, including policy and legislative actions. Action leader is the Egerton University Institute of Women, Gender and Development Studies. And again, there shall be support. We shall support the development of database of gender disaggregated data in planning and budgeting towards gender responsive budgeting. Action is Department of Gender. Again, that from the ensuring if working on issues of COVID-19, the county government of Nakuru shall prioritize preventive and promotive health care with a focus on sexual and reproductive health services. And this shall be taken up by the Department of Children's Services. Again, that we shall create an enabling environment for youths in creative arts to pursue their call, and that we shall fast track the finalization and implementation of Nakuru gender policy. This shall be taken up by the Department of Gender. Thank you.
As we all know, we are moving into an electioneering period, and it would be best if when it comes to decision making, then there is more inclusivity, and then that means the stakeholders have deliberated that they shall be able to set up voter education, which will target women, youth, people living with disabilities, so that it will ensure peaceful and inclusive general elections. On that again, we deliberated that we shall upscale voter registration through existing community groups, membership networks and forums, as well as mainstream and social media platforms. The person or the institution that will be in charge is the IBC.
In conclusion, seeing as this was a response to the COVID-19 pandemic interventions, we have reflected on disaster preparedness of Nakuru County and have proposed resolutions that the County Government of Nakuru fast tracks enactment of the Nakuru County Disaster Reduction and Recovery Policy that is currently before the County Assembly, and to mainstream the needs of women, youth, persons with disability, the elderly and children, concerns that have given rise to this discussion. And finally, use of media advocacy, that we shall adopt new and emerging media as well as mainstream media to disseminate information on gender matters. That is all.
Members of the press, in conclusion, as you can see from this convening, is a show of commitment on the part of stakeholders to ensure that these issues that have emerged are addressed. And we have agreed as a team that we are not starting, but we shall pick from where we are to monitor these issues, how they are changing, and hold periodic reflection meetings. To this end, we shall have a committee, a joint committee represented in this conference that shall hold periodic reflections where we shall assess how far we are in terms of implementation of these resolutions and take other actions as need arises. On the part of the media, we call on you also to highlight these issues so that it can catalyze action from the stakeholders who are represented in this gender conference. With that said, thank you so much, and we look forward to fruitful implementation of the resolutions. Thank you.